This is an NREMT Med Assessment.
You are dispatched to a 21-year-old female patient who is confused and acting strange.
Okay. BSI is my scene site.
Your scene is safe.
Okay. On scene, my patient's nature of illness seems to be altered mental status. Is this my only patient?
This is your only patient.
Okay, I'm gonna request ALS backup right off the bat.
Okay, continue with your assessment.
I'm gonna ask if there were any bystanders that could witness a fall or anything. Are there any bystanders that could?
Yes, the friend is present.
Hey, I'm her roommate. I didn't see her fall at all, but she just started acting really weird, and she's been sitting here this whole time.
Okay, alright, so considering that my patient is seated, there are no signs of a fall, I don't think C-spine stabilization is necessary right now, so my general impression thus far is that my patient is just confused and kind of tired looking. Does my patient look up at me when I enter the room?
Your patient does not look up or react when you enter the room.
Okay, well, hello, I'm Lisa from KCMS.
Hi.
Okay. Yeah, I'm noticing that my patient looks up at me, so they're responsible to verbal stimuli. Can you tell me your name?
Janella?
Okay. Hi, Janella. Do you know where you are?
No, not really, no.
Well, you're at home. Do you know about what time it is?
I think it's like nighttime or
Yeah.
something.
Yeah, it's about 8 p.m. Do you know how you got here?
No, I'm not too sure.
Okay. My patient is ANO times 2. The altered mental status is the apparent life threat and the chief complaint. So I'm going to continue assessing the patient and check her ABCs. Is my patient's rate of breathing adequate and is her depth adequate?
Yes, your patient is breathing appropriate rate and depth, as you see.
What's her SpO2? What's her pulse? What does the skin look like? Is there any major bleeding?
Her SpO2 is 98%, her pulse is 60, her skin is warm and dry. There is no major bleeding that you observe.
Okay, thank you. My patient's rate and breathing and SpO2 are fine, so I'm not going to give oxygen right now. Since this patient has an altered mental status, this patient is a high priority, and we're going to transfer as soon as possible. So I'll now take a history and make use of the bystander. So did she suddenly become confused, or did it come on kind of gradually?
It came on sort of gradually, and then she just became totally confused and acted kind of weird.
All right. So provocation, quality, radiation, and severity don't really make sense in this scenario, so I'm going to bypass them. And about how long did this start?
Like half an hour ago.
Okay. And about when did she have her last meal?
We had breakfast, and then went to classes, and then we walked around all day and didn't really have lunch or dinner. So I think she just had yogurt for some breakfast.
Oh, okay. Did she take any medications?
Yeah, she has an insulin pump.
Okay. Did she have a history of diabetes or any other medical history?
Yeah, I think she just has diabetes.
Okay. And what was going on before she started acting strange?
We were just chilling and watching a movie, and then like an hour in, she started acting weird.
Okay. Now I'm gonna get a full set of vitals, including a new pulse, a blood pressure, respiratory rate and quality, SpO2, a glucose, and pupils.
Her pulse is still 60, her blood pressure is 120/80, her respiratory rate is 16, and the quality is adequate. Her SpO2 is still 98, her glucose is 58, her pupils are pearl.
Okay, well, my field impression is that this patient is hypoglycemic, so I'm gonna administer oral glucose. Can my patient follow the command to bring their hand to their mouth?
Yes, your patient can follow commands.
Okay, well, I'm gonna assist my patient in squeezing a full tube of oral glucose between her gum and her cheek and instruct her not to swallow and allow the glucose to dissolve. I'm also gonna do a stroke assessment to assess neurological condition. I'm gonna still transport as soon as possible in case the condition worsens. On the way to the hospital, I'm gonna repeat the level of consciousness assessment, get another set of vitals, including glucose. Do I see any changes?
Your patient is now ANO by 4, able to speak with you, and her blood glucose is 100. Good work.
Thank you.
Did I